So you can essentially make faster and shorter acting psilocin.
Absolutely. Like we can reduce the duration of a psilocybin experience down from about 6 hours to about 4 hours just by altering the prodrug.
I see. So you're not creating a psychedelic derivative in this case where you're subtracting out the hallucinogenic effects but trying to retain everything else. You're just sort of turning down the dial on the hallucinogenic effects, but it's still a psychedelic compound.
Oh, no, I'm saying exact same psychedelic effects.
Wow.
Exact same molecule, psilocin, that's your active molecule. But instead of getting to that molecule from the prodrug psilocybin, you can get to that molecule from a different prodrug.
Similar intensity of the subjective effects, just shorter duration?
Same active molecule circulating in your blood, reacting with the same receptors in the same way.
Wow. So it's like a kinetic thing. You're just
Yes.
It's affecting how quickly
Yes.
the drug is getting into your brain and circulating and going out. Basically.
Yes, and if you wanna go and connect that to some sort of commercial driving force, if it's a 4-hour experience instead of a 6-hour experience, maybe this patient is in the clinic for a more manageable amount of time that allows or comports with like the length of a shift in a medical clinic, and rather than requiring folks to be at the clinic for 10 or 12 hours.
It turns out that the biology and the chemistry here are such that we're not going to be forced to make some absolute decision on, do we want to separate the hallucinations from therapeutic benefits? We can actually create the drug in a way that psilocin it's still inside of you and you're having a shorter duration trip. So even if it turned out that you can't separate the therapeutic side from the psychedelic side, we still have this kind of chemical tunability that can make it a more manageable drug to be administered in a clinical setting.